Right, so this is a very quick run through on carpal tunnel syndrome. And again, a very sort of stark visual aid memoir to help you with recalling the different causes of carpal tunnel syndrome. So from the top down, so carpal tunnel syndrome. So, and well, first of all, say, look, the hand here is sort of depicting the pattern that we get with carpal tunnel syndrome, with the thumb, the index, the middle, and half of the ring fingers are affected with pins and needles or numbness. Now, interestingly, that the palm here is usually spared, so actually the diagram's slightly misleading in that respect, but that's because the palmar cutaneous branch of the median nerve does branch proximal before the carpal tunnel. So that's just to make us think of carpal tunnel syndrome. Now the causes, so most commonly idiopathic, affecting older aged ladies, typically Caucasian, often with a high BMI and a short stature. So this silhouette helps to remind us about that. Other causes, diabetes, acromegaly with a sort of a wide jaw, hypothyroidism, blue indicating underactivity, or hyperparathyroidism, so red indicating overactivity there in the parathyroids. Sarcoidosis, the non-caseating, granulomatosis condition, which causes bilateral hilar lymphadenopathy. Pregnancy, patients who are on dialysis, space-occupying lesions within the carpal tunnel. Here are dorsal ganglion, but ganglions can occur within the carpal tunnel, and other tumours can too. Fractures such as a Colles fracture, rheumatoid arthritis, that can lead to carpal tunnel syndrome. And then this sort of sheet in the background reminds us of amyloidosis, which is associated with beta-pleated sheets within the circulation. And then the neck here, just remember that symptoms that look like carpal tunnel syndrome can sometimes be originating from the neck, especially the C6 and the C7 nerve roots. And cervical spondylosis, for example, or a cervical rib can cause this. So there you go, a very sort of stark image there that hopefully helps you to recall the causes of carpal tunnel syndrome. Use the unlabeled image to really help with your recall and sort of picture that in your mind's eye to recall that information and kind of empower you with that knowledge. There are more diagrams, of course, in the app, which is called Picturing MD. And if you go to the App Store, you can find it there. And the website for the project is www.picturingmedicine.com.